I think the main thing that was impressive to me when I came to campus here for the first time was just the collaborative nature between all the different schools of health sciences here. Even as I look out the window, I see the medical school and I see the dental school and the nursing school, and I've had the opportunity to really work interprofessionally with those folks a lot since I've been here. But I think that was a big focus of when I was thinking about pharmacy school. I wanted a place that I could learn to work on a healthcare team.
I chose UNC because I found that out of all the schools I visited, and I visited a few, it was the best combination of academics, organization, availability, finances, and just location. I'm originally from North Carolina, so it was nice to pick somewhere that had all the qualities I was looking for and was also close to home.
So I chose UNC because of its affiliation with UNC Healthcare. UNC Healthcare pharmacists are really the leaders in the pharmacy field and what they practice, and my goal ultimately is to be a clinical pharmacist.
I really valued being a part of a campus that has such gifted students and faculty.
UNC is also right next to Research Triangle Park, so there's a lot of opportunities there for students, and I just thought it would really set me up and provide me with the most opportunities to be successful as a pharmacist.
I chose to go to UNC Pharmacy School because of the research opportunities, the innovative practices, and the emphasis on early immersion in the curriculum. UNC Pharmacy also offers a rural health certificate for people like me who are interested in that extra training to improve the lives of people living in rural areas.
The PhD program in pharmaceutical sciences at Eshelman School of Pharmacy is one of the most unique pharmaceutical science programs. My research focuses on optimizing drug delivery for glioblastoma.
One of the great strengths, I think, of UNC as a whole is just the research enterprise that goes on here.
I visited 5 other schools of pharmacy for their PhD programs, and I felt like the research fit at UNC was really the best of the programs that I looked at. The graduate students seemed really happy in Chapel Hill. It felt like a place that I could have a work-life balance.
Why did I choose UNC? So a big part of it was the clinical collaboration, but I also kind of want it to be like, the area of Chapel Hill in North Carolina matches my personality.
It reminds me a lot of my hometown. The UNC community has been really welcoming. Transitioning to graduate school was a lot easier because of that friendly atmosphere around me.
So UNC's curriculum is really different than anywhere else. They start off with a lot of didactic coursework at the beginning, so formal lectures, and then as you progress through school, it's a lot of teamwork, working on a case with a group, and then consulting with the faculty members.
Each of the different classes are preparing me for a different aspect of my career.
So one of my favorite classes so far has been the oncology class that I took in the fall of my 3rd year. Really being exposed to this field where benchtop research can be translated into clinical treatments is really game-changing and has been one of the reasons why I want to pursue that.
As a rural scholar, you get an opportunity to engage in research during your 4th year at your continuity site. I'm currently at a hospital in Marion, North Carolina, and we are looking at trends in post-operative opioid usage with the introduction of a multimodal approach to pain management in a rural health setting.
I struggle to call it my favorite because it's probably been the hardest and the most personally challenging has been our integrated pharmacotherapy course stream. Essentially what it is, it's a case-based learning class. You're dealing with a team. You're learning how to effectively communicate and effectively disagree with folks, which is something that's really hard for us to do. Additionally, you're learning to look at literature, but then you're also learning disease states.
The fall of my 2nd year, we had a class called U.S. Healthcare. My classmates and I actually started a research project based off a national immunization database and what it would take to actually form one in the United States. We've been able to work our way to getting an IRB approved, and we hope to start in the next few months with collecting interviews so that we can eventually publish something.
So one of the ways that I adjusted to pharmacy school was being open to every opportunity. I joined a lot of student organizations to fully immerse myself in pharmacy.
What's really great at UNC is there's so many student organizations to be a part of.
Essentially, you can get involved with all these different organizations that are involved with community outreach and involved with shadowing experiences, the hospital, that can really help refine exactly what you want to do on a day-to-day basis. And then kind of when you know what you want to do on a day-to-day basis, you can kind of tailor your career in that way.
I think every time that you go to a next step, whether that's school or job, it is a little bit tricky getting your bearings, relearning how to study, just figuring out what works best for you.
I don't care what people say, the first day of school is the first day of school no matter how old you are.
I experienced a bit of burnout in the beginning, and the faculty as well as the Office of Curricular and Student Affairs really helped me to get back into my groove and to bounce back.
I'm grateful for all the resources that UNC provided. I think the biggest resource available that we don't usually think of are just older students and other students.
As a first-year student, you're put in a peer mentor group, so I became friendly with my classmates in that group as well as upperclassmates.
I found the faculty at the University of North Carolina to be a really excellent resource for understanding what my career will look like.
A lot of them also serve as mentors who can give great advice and really want to see you succeed as pharmacists.
The faculty here have been more receptive than I could have imagined in regards to meetings, and that's actually how I kind of found my research project that I'm involved with here.
They give us every outlet, everything that we need to be the most prepared pharmacists in the industry.
But asking for help with all the experts here, like they are an expert in whatever you want to discover, like ask them.
So resilience is really important in graduate school because science itself is unpredictable. You collect data every day and it doesn't always align with what you were thinking, and so you have to kind of consistently be going back to the literature.
And then I feel like it's one of the greatest assets that I have is teamwork.
Confidence, resilience, and independence.
How to be resourceful, a good team player, and just the importance of keeping a positive attitude.
Transitioning from pharmacy school to a PhD program, I was a little nervous at first. I definitely had imposter syndrome. I was accepted into a research lab that helped me develop my skills in research and helped me develop my skills in writing. I'm in my 3rd year in the PhD program and I could not have thought of a better place.
Number one school pharmacy, if you're here, you're meant to be here.